Trust for America's Health has released its 20th annual obesity report, and Oklahomans and Americans in general of all ages continue to put on weight. This week I spoke with Dr. Nadine Garcia about Oklahoma's obesity rate, which is the third highest in the nation. Dr. Nadine Garcia, President and CEO for the Trust for America's Health. What are the contributing factors to Oklahoma being the second most overweight state in the nation and the third most obese?
Obesity is a complex disease, and there are multiple factors that contribute to obesity. It's actually factors beyond just genetics and individual behavior. It really much of it having to deal with social and economic and structural factors that contribute to obesity. When we look at issues like poverty or financial hardships for families where they're living paycheck to paycheck to be able to afford healthy and nutritious foods.
So then Oklahoma's not doing a good job in providing some of those things?
And certainly Oklahoma, as well as states across the nation, are facing and seeing rising rates of obesity among adults as well as among children. There is progress that has been made, but part of the challenge is really funding and investing in proven obesity prevention programs that we know work. For example, the nutrition support programs like the Women, Infants, Children's program, which is shown to actually reduce obesity among children. The percentage of kids who are eligible for that program, many more kids actually could be participating in that program who aren't. And so we need to work on, for example, reducing those kind of administrative hurdles and barriers that many families face to being able to access those types of programs.
Dr. Garcia, before we go any further, just define obesity for us and how many Americans are considered obese?
An individual's body fat and their body fat distribution is higher than what's considered a healthy level. Now, this isn't really about body size, but it's really about understanding how do you maintain a healthy weight. And by utilizing that index, which is universally available in screening, it helps give an understanding as a population health measure. How do you direct resources? What types of strategies that you would use for obesity prevention?
So what are the numbers? How has it gone up? Would you say it's gone up dramatically or steadily?
Over the past 2 decades, the rates of adults living with obesity has increased by 37%, and among children, it's increased by 42%. Where we are now as a nation is that slightly over 4 in 10 adults have obesity, and 22 states now have obesity among adults at a rate of 35% or higher.
So, doctor, what about some of these new drugs we're hearing about, Wegovy and Mounjaro? Are you a proponent of those as a way to combat obesity?
There are these new medications that are coming into use in healthcare, and they have the potential really to transform what we think about as we think about the treatment, management and treatment of obesity. There's much more that's being learned, more research that's being done. We also need to focus on prevention. And the challenge is we haven't invested as a nation in prevention the way that we should. As an example, one of the leading obesity prevention programs that's funded through the Centers for Disease Control and Prevention funding states only has enough funding to be able to fund 16 states across the country. And yet this is a national issue that every state is addressing.
We've talked a lot about what government can do. What about the individual? I mean, there has to be some personal responsibility in this as well.
There are multiple factors that contribute to obesity, many that are beyond personal choice. And yes, we can all take measures to have active, healthy lives, whether that's healthy, nutritious diets, as well as engaging in physical activity. But when you see these types of increasing rates of obesity across population groups that has been going on for decades, there are structural and systemic barriers that we also need to address. And making healthy school meals, for example, accessible for all students, making that permanent policy. Looking at expanding, for example, access to health insurance coverage, where far too many people, millions, still don't have access to health insurance coverage, or expanding Medicaid. The state of Oklahoma, just in the past 2 years, expanded Medicaid, increasing access to coverage. So everyone has a role to play really in improving our systems and our structures to assure that everyone has the opportunity to be able to access healthy and nutritious foods and to engage in physical activity.
Dr. Nadine Garcia, President and CEO for the Trust for America's Health. A lot of challenges ahead, but we appreciate your time and the information.
Thank you, Rich, very much for the opportunity. It was great being with you.